You have exactly 90 days to master your role here at eMend Healthcare. As a behavioral health technician, mastering Module 13 means understanding exactly how you fit into the flow of admission, discharge, and clinical documentation. The stakes are established the moment you clock in. Every routine intake task and chart entry you make operates under strict California DHCS Title IX compliance standards. There is zero room for error. To navigate this environment, you rely on a single governing rule for your entire shift. You are here to support the patient, not to assess them. Maintaining that boundary allows you to function safely in a high-pressure clinical setting. Overstep it, and you risk compromising the patient's entire care plan. Let's see how this works in practice during a new admission. When a client arrives, your authorized responsibilities are straightforward. Perform the orientation and enter routine background information. This diagram illustrates the workflow. Every admission requires two specific screenings, the CSSRS for suicide risk and the ASAM criteria for level of care. These create a hard operational boundary for your role. The moment these screenings begin, you must pass the baton to the licensed clinical staff. Your side of the process locks down, leaving the assessment gateway open exclusively to therapists and case managers. Playing detective and stepping into an assessment role legally invalidates the care plan and creates a severe compliance liability for the entire facility. Midway through your shift, the focus transitions to the electronic medical record, or EMR. You are responsible for generating progress notes and the shift report. These entries operate under two non-negotiable standards. They must be completely accurate, and they must be filed on time, every single shift. The most common pitfall here is the urge to document a clinical assessment, a diagnosis, or your own personal opinion. None of those belong in your notes. Look closely at this split screen. On top is a subjective note loaded with diagnostic language, which is strictly prohibited. Below it is the correct approach, a clean, structured record containing only factual observational data. Your progress note serves as a strict legal snapshot of reality. Injecting subjective opinions actively contaminates the patient's legal record. Creating the record is only half the job. Protecting it is the other. Your duties tie directly back to the baseline privacy standards. Proper record retention means treating physical documents with the exact same high level of security as your digital files. A paper folder left open on a desk is a data breach waiting to happen. The same rigid boundaries apply to release of information requests. As a behavioral health technician, you never independently authorize the sharing of a patient's chart. Guarding the record is the ultimate act of patient support. Treating their private data with the exact same urgency as their physical safety establishes the trust necessary for their recovery. The routine of a shift can break instantly. A patient unexpectedly packs their bags and announces they are leaving against medical advice, or AMA. There is a strict rule for this scenario. You must never attempt to negotiate, block the exit, or handle an AMA situation on your own. Your required action is immediate, direct communication. You notify the clinical team, therapists, and case managers so they can step in and take over the procedure. During an AMA, your rapid escalation is the single most critical factor in preventing a dangerous lapse in the patient's continuum of care. Compare that emergency response to a routine planned discharge. Here, the protocol is calm, and your only role is to simply support the generation of the discharge summaries. As your shift draws to a close, keep the three core pillars of your role in mind. Intake tasks are meant solely for support, EMR notes must remain strictly observational and on time, and an AMA situation requires instant escalation. Knowing these operational boundaries makes you an essential and trusted member of the team here at eMend Healthcare. By rigidly maintaining these operational boundaries, you ensure the entire clinical machine runs safely, legally, and effectively.